I'm Brant Nikolaus. I'm an orthopedic surgeon at the Utah Institute for Robotic Surgery. I'm very well versed in all the different approaches to hip replacement, but the one that I feel the strongest about, the one that I prefer, is the direct anterior approach. So I use a special table called a HANA table, where people can be on the table, they're supine, letting fly on their back, and that way I can actually manipulate the leg into a specific position so I can get better exposure. And with this specific approach, it's on the front, and I do two different types of incision. I can do a standard incision, which is straight up and down. I also do a bikini incision on specific patients, where it's more in line with the line of your underwear. And with the direct anterior approach, you don't cut any muscles. So you go between them, you end up having to stretch them a little bit, but do a small incision, about 10 centimeters or so, and you're able to go between the muscles and not cut them to get exposure to the hip. And then how it works is you remove the ball and remove that arthritic bone on the acetabular or the cup side with a reamer. And with that, you're able to remove all that arthritic bone, get down to good, healthy, bleeding bone, and put in the acetabular component, or the cup. And I like to put in a couple screws to kind of help hold things in place while the bone actually grows into those components. And then we go to the femur side, which you put a stem inside the bone that goes down in the bone using very special broaches. But again, not cutting any muscles, but with the special table, I'm able to manipulate the leg to get the good exposure, to be able to get that component in place. And then also, with the special table, I'm able to use X-ray intraoperatively. Fluoroscopic imaging, I'm able to see exactly, make sure I reproduce the offset and the length, make your leg lengths right where they're supposed to be by matching the other side. And then you're also able to test the stability with this table. For me, anterior hip, people do very, very well. Most people stay just one night in the hospital. They're up walking the same day with physical therapy, and I like people to be on 2 crutches or a walker until they can walk without pain, and then a single cane or a crutch until they can walk without a limp. Most people come back at 2 weeks, they're walking without any type of gait aid, most are off pain medications, and people are feeling pretty well.